Okay, up next we will have Nancy Galvagni. She's the president and CEO of the Kentucky Hospital Association. Most of you all know her. She's going to drive home our morning remarks by providing a snapshot of Kentucky's current hospital workforce. Ms. Galvagni is responsible for the operation and direction of all the activities of KHA, and she furthers the mission of the association by leading policy development and advocating on behalf of its members. She's been serving the association for over 40 years by holding a variety of management, policy, and advocacy roles throughout her tenure, which means her experience and exposure makes her the ideal person to round out this morning's conversation. So without further ado, please help me welcome Ms. Galvagni.
Thank you, Leslie, and thank you, Dr. Thompson, for inviting me to be here today. I really appreciate the opportunity to talk about our hospitals and to share some data with you, and along with some recommendations that our Workforce Committee and our board has met to address the workforce. Get my technology going. Great. So I thought I'd start this morning just giving you a little bit of background about our hospitals in Kentucky. And because obviously this information has implications for workforce. So there's 128 hospitals in our state. 96 of those are short-term acute care hospitals, and the rest are specialty facilities. 56% of our hospitals are rural, and that's 20% higher than the U.S. average. And of course, that's because Kentucky is the 10th most rural state in the nation. 70% of our hospitals are the only hospital in their county. They're the sole provider. And so that's really important when you think about access to care, because these hospitals are truly the safety net for their communities. So our hospitals are important not just to maintain access to care, but they're often the largest employer in their community. Collectively, Kentucky hospitals employ over 77,000 people. And of course, they're very important to the economy. Collectively, hospitals create $13.5 billion in economic benefit to our state, and that's through the taxes and the purchases that they make and that their employees make. Our hospitals treat a much more vulnerable population than hospitals nationally, and this creates major financial challenges, particularly for our hospitals that are in rural areas. So most people might not realize that on any given day, there's 70 to 80% of the patients in our hospitals are covered by one of two government programs, that being Medicare and Medicaid. And that's 10 to 20% higher than the national average. A recent study found that Kentucky hospitals have the 7th highest percent of inpatient patients that are covered by Medicare or Medicaid. And this high level of government patients creates financial challenges because both of these programs pay below the actual cost, not the charge, but the cost for delivering care. And it's a particular problem for our rural hospitals because they have more Medicare patients and fewer commercial patients to help subsidize the losses from these government programs. Our Kentucky hospitals are also challenged because the patients we serve are sicker than the national average. Kentucky has high rates of patients with chronic disease. Our state's at the top of any list of leading indicators of death in the United States. And Kentucky has the 5th lowest life expectancy, the ultimate measure of poor health. So the combination of more government patients with below-cost reimbursement, coupled with sicker patients that require more resources, creates considerable financial pressures on our hospitals. Earlier this year, a national consultant, Kaufman Hall, released a report that found that in 2022, Kentucky hospitals had a negative 4% operating margin, and 38% of our hospitals were at risk of closure. Having an adequate workforce is key to providing care that our population needs, and our hospitals are very invested in workforce development. Hospitals have plenty of physical beds, but we can't staff all the beds without an adequate workforce. Workforce development requires having credible data to make decisions on. So every year, Kentucky Hospital Association conducts a workforce shortage survey to quantify the number of vacancies in our hospitals and to evaluate trends both at the state and the regional level. This year, in addition to conducting a study of our workforce shortage with our members, we engaged a national consultant to project the future supply for nursing. KHA's Workforce Committee and our board reviewed this data. We adopted a number of recommendations for stakeholders, and I'm pleased to share this data and our recommendations with you today. So where are we today? Well, according to our 2022 workforce survey, there were nearly 13,000 vacancies in Kentucky hospitals at the end of 2022, and that's a slight improvement from 2021. There's also been a slight reduction in nursing vacancies, 300 fewer. And as I talk to CEOs, I'm also hearing, thank goodness, less reliance on contract labor because more nurses that were traveling have come back to take full-time positions in our hospitals. However, as you all pointed out, Leslie, turnover has really not improved. And actually, there was a slight increase in turnover among all positions and really no change in turnover for our nurses, and that's staying at about 22%. Almost 60% of the nursing vacancies in hospitals are in 4 key areas. The largest, 30%, being in medical surgical units, almost as high, 27%, in critical care, and then followed by shortages in the emergency department and in OR and recovery units. And this is really no different than in 2021 in terms of the areas with the greatest vacancies. We also continue to see a shortage of experienced nurses, since most of the nursing staff in hospitals are between the ages of 21 and 40. And in 2 of the most critical need areas that I just shared, those being OR recovery and in med-surg units, we also see higher rates of nurses reaching retirement age. And so that's going to create an even greater pressure in those areas of the hospital. Outside of nursing, lab, imaging, and respiratory therapy continue to be the areas with the highest number of vacancies. And this is a problem because the shortages are constraining availability of services. For example, I was just meeting recently with a small rural hospital, and they were telling me how they were not able to offer certain imaging services on weekends or not every day of the week due to staffing shortages. So this slide shows no real changes in these areas between 2021 and 2022. So what does the future look like? So this year, as I mentioned, KHA engaged a national consulting firm called Global Data to produce projections for the nursing workforce to help inform planning and decision-making. The projections account for nursing needs across all settings, not just hospitals. The projections are based on a model that estimates future demand against future supply. The demand estimates take into account Kentucky demographics, health risk factors of our population, disease prevalence, and our utilization patterns, which of course are higher than the national average. The supply estimates are based on licensing data that was shared with us by the Kentucky Board of Nursing, and we adjusted that data to only consider RNs and LPNs active in nursing. Supply adequacy is benchmarked at the national average level of care. So if you think about it, there's a national nursing shortage. So the shortages identified in this report for Kentucky might even be greater than what's been projected. We looked at several scenarios. The status quo scenario is based on no significant changes occurring in healthcare delivery or in the number of entrants into the workforce or retirements from historical patterns. In a nutshell, the report found we face significant challenges to have a sufficient supply of nurses in the future. Our state's demographics are not favorable, and that's because the traditional working age population from ages 18 to 64 are projected to decline by 2% by the year 2035. So that means healthcare is going to have to get a greater percentage of that population to go into healthcare, or we're going to be behind the curve. And the study projects a large and persistent shortfall of registered nurses and a growing shortfall of LPNs. When we look at projections by the year 2035, with respect to registered nurses, the study projects a demand for nearly 59,000 compared to a supply of 53,000. And the deficit is due in part to a projection of fewer applicants and graduates. With respect to LPNs, the supply is projected to decline due in part to retirements and career changes. And actually, when we looked at the LPN age, today we have a much older population that's working as LPNs. The bottom line is that Kentucky is not projected to see any appreciable improvement in terms of resolving the nursing shortage by 2035 under the status quo scenario, and that being no change in the delivery model or growth in the pipeline to produce more nurses or a change in the retirement pattern. The model shows a current shortfall of 6,190 RNs across all settings, and this supply is not even sufficient to provide the national average level of care. Our study showed that it's only meeting 89% of the current demand, and that's today. By 2035, there's projected to be a shortfall of 5,790 RNs, and that supply will only be adequate to meet 90% of demand. So that's about where we are today. So again, there's no real appreciable improvement in the supply of nurses. I'm ahead of myself there. By 2035, Kentucky's projected to have a severe shortage of LPNs, growing to more than 3,000. The study indicated it will take adding 630 more RNs and 370 more LPNs annually to close this gap. These numbers change only slightly if there are improvements in supply through more entrants into nursing schools beyond what we normally have seen, or less people retiring in relation to what the expectations are, which is why we agree efforts are needed both to grow the pipeline as well as to retain the existing workforce. So now, what is KHA doing about all of this? So our workforce committee, after looking at the global data report, developed recommendations for our association, for our members, and for other stakeholders. So KHA, we are collaborating with hospital HR professionals. We're preparing reports like this data that I've shared with you today to track, what's happening. We are addressing retention. We are leading a group of chief nursing officers to share ideas on how to change the delivery model. And we're providing training for our hospitals on workplace safety. A major initiative started this year is our partnership with the Kentucky Chamber's Talent Pipeline Management Program, or we call it TPM for short, where KHA has funded 5 regional positions that will focus exclusively on the hospital workforce. TPM is based on supply chain economics to grow the supply of workers through marketing, education, and training. So instead of our hospitals competing with each other, the goal of TPM is to grow a larger supply of workers for a larger hiring pool. So this is going to start in primary and secondary schools to develop interest in health careers, and it's going to continue through post-secondary education. So KHA and our TPM managers are going to convene and connect our hospitals, our schools, and our community partners to understand and address regional needs and resources, and to also collect and share and disseminate best practices. Our members are also very engaged in workforce activities. These include working with high schools on health careers and developing new healthcare training programs in high school, collaborating with education programs to provide clinical faculty and rotations, providing scholarships for students to pursue health careers, and as has been mentioned, many have these career pathways where they will pay to advance a person's education. Hospitals are providing more flexible work schedules, and several are implementing virtual nursing to support existing nurses, and that's really proving very valuable for our new nurses. And as I've mentioned, they're collaborating on work redesign and workplace safety. So KHA's Workforce Committee and our board also develop recommendations for other important stakeholders, those being educational institutions and our legislators. For education leaders, we recommend that schools and hospitals work together to develop LPN training in high school, as has been done in other states. Pikeville Regional Medical Center, for example, is currently working with their community college to develop such a program in Eastern Kentucky, and we believe this could be done in other regions of the state to address the severe coming shortfall of LPNs. This is also going to help address the nursing shortage in hospitals because, again, through these career pathways, people can come in as an LPN and the hospitals will pay for them to get their nursing degree. We also support increasing the number of faculty to provide more seats in nursing schools and other programs for training other allied health professions that are in high demand. We recommend improvements in the admission process to nursing school so that more qualified Kentucky applicants are admitted, since we believe there's a higher chance that Kentucky students will remain in Kentucky to practice. And we've already seen that we're a net exporter of nursing graduates. We support exploring a standard curriculum so that credits can be easily transferred among nursing education programs, so students don't need to repeat courses, which adds time to graduation and can lead to dropout. We have several recommendations for our legislators. First and foremost, we asked the legislature to build on the great work they did earlier this year when they increased the penalty for assault against a hospital worker in the emergency department. Unfortunately, violence is occurring throughout the entire hospital, so it's important for those protections to be expanded so that they cover every worker in the hospital. Hospital workers are 6 times more likely to be injured on the job than workers in the private sector. And we already know we have a severe shortage of healthcare workers and that violence is a contributing factor. It's a source of burnout, turnover, and even nurses leaving the profession. No healthcare worker should come to work and be afraid. So we hope that the legislature will work with us during this session to advance this initiative. To increase the pipeline of healthcare workers, we also recommend that the legislature provide additional funding for workforce in several areas. We support providing funds to match the private donations under House Bill 200 for these healthcare scholarships. We think that's important to get students to enter health careers if they know that their education can be paid for. We support additional funding for classroom and clinical faculty salaries so that the number of seats in the nursing programs can be increased. We support additional funding for schools to provide the wraparound services discussed that are very needed to support students so that they can graduate from these programs. We also ask the legislature to support the development of new provider-based apprenticeship programs that can serve as an alternative path to certification for some of the allied health professions that we need. We also support requiring all healthcare licensure boards to implement more robust data reporting, like the Board of Nursing has done, to better allow all of us to have data to see what our needs are in workforce and to better plan in professions beyond just nursing. And as has been mentioned, to help workforce participation, we asked to collaborate with our other stakeholders to find solutions to those factors that are preventing people from entering the workforce, and childcare has been mentioned, and that's certainly a big area of concern for our hospitals. So, in conclusion, thank you again for having me here today. The need for more workers is very crucial for our hospitals and our patients, because we all know that all of us at some point are going to need the healthcare system, and we want the best care possible for all of us when we need it. So I thank you for allowing me to be here today to present this information to you, and I really support your leadership, Dr. Thompson and Leslie, and have appreciated your partnership and look forward to continuing to work with you.